So let's have a look at the pancreas and its ducts in a normal condition. So this is the C-shaped duodenum. This is the pancreas. This is the head of pancreas. This is the major pancreatic duct, and this is the cystic duct coming from gallbladder, and this is the common hepatic duct. Together they are forming the common bile duct, and this together forms the hepatopancreatic duct by merging with the pancreatic duct, which opens at the second part of duodenum at sphincter of Odda. So this is how generally and pancreatic enzymes are secreted in the acinar cells and conducted through the tubules or ducts and released in the second part of the duodenum. Now let's look at what happens in the abnormal condition. So let's say if there is any obstruction in the pancreatic duct, anywhere in this pancreatic duct, that can cause the accumulation of the pancreatic enzymes, and that will lead to the acute pancreatitis. So let's see what exactly happens here, or what you can write in the exam. First of all, pancreatitis is inflammation of the pancreas. The reason is due to obstruction of the pancreatic duct. That will lead to the accumulation of pancreatic enzymes. And this is an important question in physiology viva also, in physiology exams also, that what is the role of trypsin inhibitor. Now trypsin inhibitor is secreted along with the pancreatic enzymes, and its function is to prevent the autodigestion of the pancreas. But if there is accumulation of the pancreatic enzymes eventually overpower the trypsin inhibitor, and that will lead to the autodigestion of the pancreas. So this is what happens, and the promoting factors are ingestion of alcohol, the viral infections, trauma, or any road accident, or any kind of accident for that matter, and gallbladder stones, that we will discuss in details. Let's see. So imagine this is the liver, this is gallbladder, and this is the ducts which I have already told you about. So let's say there are gallbladder stones. Okay, so when bile is released from the common bile or from the cystic duct or into the common bile duct, some of the gallstones can also be released in this secretion, and that might get stuck here and can cause the obstruction of the main pancreatic duct. So this obstruction by the gallstones can cause pancreatitis, and the mechanism I have already explained you, that how the accumulation can cause the damage to the pancreas, right? So this was it, and symptoms could be severe pain in the epigastric region, or fever, nausea, vomiting. And one more thing which is very important also, MCQ, that is the serum amylase level. The serum amylase level will rise up to 4 times during the acute pancreatitis.